a lot of review for many of you, but we've had a lot of new people come into the program, a lot of new staff and a lot of new volunteers. So we thought this would be a really good review for everybody. If you haven't seen it before, this will be new for you, but we thought this would be a really good time to go back over some of these programs that we have in the past, but this is a new time. So there are several programs for people who have problems paying for their Medicare. Different ones help with different things. So we've got LIS and Extra Help that help with the drug costs and the Part D premiums. That can be a really good big help to a lot of people if they are struggling to pay from some really expensive medicines. This is a really good program to at least screen them for, and then of course apply if they are qualified. The Medicare savings programs can actually help with those Part B premiums. It helps with that monthly premium. And depending on their level, it may also help with any deductibles, the co-insurance. So there's not any out-of-pocket cost at the doctor as well. So it just really depends on what level of services that they qualify for. Then, of course, the Medicaid program, which is a federal program for people who are very, very, very low income. The income guideline this year for Medicaid is $794 or less. So it is very, very low income individuals that qualify for that, and it gives them a secondary to their Medicare when they go to the doctor, so they have no out-of-pocket cost. It gives them even lower costs than even the Extra Help program as far as their drug costs, and their brand name medicines are very, very inexpensive for them. So there is a difference between Medicare and Medicaid. I know all of the time I get those questions and confusion on what's the difference between Medicare versus Medicaid. So Medicare is a national program, and everybody across the board has the same Medicare. It's Part A and Part B. You get a drug plan, or if you want to have it all lumped into one, you get an Advantage plan. Medicare is completely administered by the federal government. The states have no control over the Medicare program. You do have age and disability limits, so over the age of 65, or people who have certain disabilities, and then of course end-stage renal disease, you get Medicare. It's the same Medicare, but it's specified for that group of people. Then the nation is the primary patient. Medicare is the primary, and that's it. That's all they have is Medicare or a Medicare Advantage. So the Medicaid program, the biggest difference is the states handle Medicaid programs. It's still a federal program, but the states mandate how they handle it. So different states have different things. Different states have a higher threshold of letting people on their books. Some people have a very limited eligibility that's set up. So it just depends on the way the state that wants to handle it. They do have to give a base minimum as far as like the federal rules. They do have to follow those federal rules, but the states do have a whole lot of play into how it works. It is a needs-based program, so it is specifically for people who are very, very low income, and or children, or people who have very specified health illnesses like breast or cervical cancer, things like that. So, but it is a primary payer also. So it can but if they have any other insurance, it is going to be the payer of last resort. So Medicare would always pay first if they have Medicare and Medicaid together. So qualifying for these plans, there's a couple of ways you can do that. You're going to automatically qualify if you're already on Medicaid, maybe you're aging onto Medicare, and you have been on disability and you have full Medicaid through the state, or if you're receiving that SSI income. SSI is actually an income for people who make less than that $794 and they have some disabilities. So if they get that SSI income, they automatically get Medicaid because they're already making less than the $794. Also, you qualify for extra help if you get a Medicare savings program automatically. So that's the QMB, SLMB, and QI1 programs that we'll go over in just a little bit. But everybody else, they have to apply for it, and they have to send in documentation and proofs to prove that they would qualify for it otherwise. There are several different ways to apply. My suggestion is to tell people to call SHIP. It is the easiest way to get things done. We can get it, we know how to fill these applications out. We've done it a million times. So we can be sure to ask the right questions and get the right boxes filled out. So I know SHIP's they're on the last, but that's my first go-to. Let's call SHIP first. If they do feel comfortable doing it themselves and they would prefer to do it themselves, which we have had that happen, they don't want to give out their personal identifying information, just let them know that they can go to the Social Security website, and the link is on here. So just let them know that they can go to Social Security and get to the extra help application that way. They can also call Social Security and they could do that over the phone with them if they would prefer to do it over the phone with Social Security instead of with us. Some people feel more comfortable calling a governmental number instead of, they're not as familiar with SHIP and what we do. So, we understand. You can also, just make sure that you're putting in there that you're looking for the application for help with prescription drug costs. Or if you type into the search bar just extra help, it will come up. So it's easy to get to it on Social Security. So there are income and resource limits for these programs. All of the programs across the board are income and resource based. For a individual, it's $1,630 this year. For a married couple, it's $2,198 for the month. And it does go up based on family size. So if you have a couple who has custody of a grandchild or another family member lives with them that they support, then they would add them into their household size as well. So it can be different numbers if they are in that situation. So resources also play a part. These are going to be anything like savings, investments, any real estate above and beyond the house that you live in. Some people may have like a HSA or a FSA that they saved up throughout their time at work, and that's great, but those do count as resources. So you do have to add those in, and retirement, 401ks, things like that do count as a resource for them. It can be up to $13,290 for an individual, and then also up to $26,520 for a married couple. So the limits here are a little bit higher than the limits we'll see in just a minute, but this does give them a little bit of leeway in having some resources. They can also add a $1,500 per person bonus, so to speak, for people for the funeral or burial expenses if they have it. The key is here they have to be set up in a burial trust, so it can't necessarily just be, oh well, we have an extra $3,000 or $1,500. It does have to be specifically noted that it is for burial expenses, and it has to be an account that can't be touched. So it does count any savings and investments. Also, it does count if someone got their Social Security back pay after a year of being in, if say they decided to spend a little, but then they put some into savings, that will count after that first year. So you do need to ask them if they have any of that left over. Also, another thing that counts is if they co-sign for someone. So that would be a really good question to ask as you're screening for these programs. Have you co-signed for any home or property or a car or anything with maybe a son or daughter or family member, whatever, but it will count for them if they do that. So some of the benefits of extra help, one of the benefits is that it reduces the premium by $30.20. So a lot of the plans, if they are participating and they cost less than that $30.20, that means that that plan will not cost a penny for the person each month. So they won't have an out-of-pocket cost for the premium. Now, if the plan is more expensive than the $30.20, that $30.20 will be reduced, and then they will just pay the difference. So that will be a lot cheaper for them. So they might can get a more expensive plan and not pay as much for it. So they do have reduced co-payments. So this is a really big help. So a lot of the brand name medications out there, they're super expensive. Diabetes medications, a lot of the new things, everything you see on TV, if it's on TV, it's probably one of the most expensive medicines out there. For these people that qualify for these programs, they pay $9.20 for those brand name medicines, and that's the maximum that they pay. As long as it's in on the plan's formulary that they're on, they can get that discounted rate for those medications. And another good thing is if they if they're on a certain medicine and it's not covered by a certain plan, they do have the ability to change plans on a quarterly basis. So if a doctor wants to put them on a really expensive medicine, they can actually get onto a plan that will cover it three times a year. Then the fourth time will be during annual enrollment, and it will start in January. So $3.70 maximum for a generic. Usually it's less than that, but just depending on the cost of the generic. Some plans out there will cover generics for free anyways, so it will be up to the plan what that is, but they can't charge any more than the $3.70. Another good benefit is they have no deductible. The maximum deductible this year is $445. People who are on extra help will not have to worry about that. They also never get into the donut hole or the coverage gap. Unfortunately, they said the coverage gap was going away, but it didn't really necessarily go away. It just changed a little bit, and they will not charge any more than 25% for the medicines during that time. So people who are on extra help do not have to worry about that 25% copay, because that can definitely be expensive, because it's 25% of the full cost of the medicine that they would have paid had they not been covered with the program. There also are programs for people who may, maybe their resources and their income is kind of on the limits, but maybe they have some other extra issues going on. Where they can get some partial extra help, and it'll pay at least a portion. There will be a reduced deductible. Um, it'll definitely be a lot cheaper for them as well, but it just depends on the level of their income and resources. And it could be 25, 50, or 75% of the extra help program. So applying for extra help, we kind of went over that just a few minutes ago. Just really and truly contact SHIP, because that's really the best way to get it done. We can do it really quick. It takes about 15 to 20 minutes tops on the computer. It's really easy to do. There is a paper application. Social Security really does not like to use that. But you can call them and get that sent to you, or just do it online yourself at socialsecurity.gov if you want to do it that way. So some of the Medicare savings programs, those are the ones that help for that with that Part B premium. So we have 4 different levels. We have the extra help. I'm counting extra help in on that. Hmm? Did it skip? It did. Yeah. Okay, so I don't know why it does that. The slide is there, but it's not showing. Well, we'll talk about it. I could talk about this in my sleep, I swear. So, there's 3 different levels of Medicare savings programs. You've got the QI1, which is the highest income guideline that is out there. So $1,469 for a single person. So if they make less than $1,469, they are going to get some level of assistance with the state to help pay for that Part B premium. The resource limits stay the same across the board for all 3 of the Medicare Savings Program, and those resource limits are $7,970. And then for a married couple, it's $11,960. You'll see that's a lot less than what the Extra Help program is. The state is a lot more limiting as far as what who could qualify for these programs. Unfortunately, Tennessee did not expand their Medicaid program, and they didn't expand some of these programs. So unfortunately, we have very tight limits on qualifications. So for the QI1, we have that all it does is pay for the Part B premiums. That's strictly it. It doesn't help with any doctor costs. The SLMB program, which is the next level down, it is, hold on, my numbers. I do not memorize anything anymore because it changes so quickly. So the SLMB limit is $1,308. So that gives a little bit for people who make a little bit less. The resources are the same. And then the QMB is for people who make the least amount of money. And that income guideline is $1,093. So yeah, it's definitely very low. The good thing with the QMB program, on top of that Part B premium, it also pays for the doctor visits, deductibles, any co-insurances they may have. So they won't have those out-of-pocket costs. And it's actually illegal for doctors' offices to bill people who have QMB for those costs. So that definitely saves them a whole lot of money. So these programs, it's really, really important that we screen everybody for them. Everybody that we talk to, we should be asking questions about income and resources to see if they could qualify, because a lot of people don't know that these programs exist. It's really important to get that information out there. Okay. Okay, so there is another program that helps for people who are, I think, Alika's gonna come fix me. It wouldn't be SHIP without technical difficulties, guys. Okay. Wait a minute. Okay, here we go. Back to where I was at. All right, so we are looking, did you put on the, no, okay. So the Line program is another program for these individuals who may qualify for these programs, but they haven't already signed up for a drug plan. It gives them a little bit of time to set everything up, call Medicare, call SHIP, get a drug plan chosen, and it gives them that little bit of time it takes. It might not start till the next month, so it would definitely be good for them to use this because it gives them those benefits without having a plan yet. It is through the program Humana. There are several different ways that people can enroll in it. It may be that they're auto-enrolled by CMS. It could be done at the pharmacy through point of sale. And then also they can save their receipts and retroactively send those in and get reimbursed for any monies that they spent at the pharmacy. They do have to be eligible for Part D and Medicaid, LIS or SSI, and need a drug plan. And then they also need to have that, their, sorry, I lost my train of thought. So they also provide immediate prescription coverage at the pharmacy counter. So if they have a prescription in hand that they need to get filled and they don't have a Part D, that Humana program will pay for it at the pharmacy and they will have that discounted rate. The pharmacy, there's a form that they fill out and they put in some bin numbers, and we'll go over those in just a second, but it's they can actually process it by the claim itself. There's not very many restrictions. There's, as far as the network, you could pretty much go to any pharmacy to get this program. It lasts about 2 months. They don't, that gives you just that couple months to get everything settled down, nailed down for your plan. It's just kind of a bridge to coverage. So that's kind of what it is. And two, if they do need that retroactive reimbursement, they do need those receipts. If they use a specific pharmacy, they could get a printout of all of their medications that they got during the time frame from the pharmacy, and they should be able to put that in there as well as to get reimbursed. Okay, wanting to progress. Oh, there we go. All right, so here's the PCN and the bin numbers that the pharmacy will need to submit the claims. You can share this with the client that they could take this and say, I want to use the Line program. Here's the information to put in. That will need to be all they will need like the claim number and things like that. They will need that as far as the submitting the claim. So just let them know that they do have to provide that information, and it has to be the full number. It can't just be the last four digits. It has to be the full numbers. Okay, so we have a client who needs help. What can we do? So the first thing you need to do is just to assure them that there are assistance programs that will help them if they qualify. And just ask them if they'd like to be screened for services. That is one of the first things to do. Just let them know that you are going to have to ask about income and resources if they don't feel comfortable giving that information. There are some ways to kind of talk about it without just openly saying how much do you make. You could ask them, if you're having trouble paying for your health care medication costs, you can give them the limit number. You can ask them, is your total household income under $1,630? If they don't, they could either say yes or no. It's not getting a specific number. So, but it's a way to kind of open up the door to talking about this, because a lot of people, they're really, they're self-conscious about it. But once they find out, if you're there to help them and they are under that $1,630 income threshold, then they will be very helpful. They will be very happy to get this assistance. So once you determine that they're under that $1,630, you would need to find out a little bit more about what their income is, kind of nail down that number a little bit better. Then that way you can determine if they're just eligible for LIS or if maybe they would qualify for some of the other programs as well. So then you could kind of go into the Medicare savings programs part of it and say, this will help you pay for that Part B premium as well, and that will help save you more money on top of what the extra help program would help. So also, don't forget to ask about resources. I have talked to so many people who their income is perfectly well within limits, but then I found out later that either they co-signed for someone, or maybe they own a property in a different state, or maybe they have a car that they are restoring, or a motorcycle, or a ATV or something like that, that counts as a resource. So you do make sure that they are eligible based on that as well, just to screen those out. So some important things to tell a client when you're helping them is that the application processing time can vary depending on how they apply. So if you guys do a paper application with them, especially if it's a TennCare application, it can take up to 45 days after TennCare receives the application. So with a paper application, you usually fill it out either with them or for them and mail it to them. They have to look it over, sign it, make sure that they get their proofs together. That usually takes probably a few days, depending on the person. Once they get it back in the mail, it's got to go to TennCare. And then once TennCare actually receives that application, it could take up to 45 days. So that's a long process. That's why, there's a lot better processes out there now. Calling them on a three-way call, or being in the room with them when they call TennCare, that gives a little bit better response time from them. It could be 1 to 2 weeks, and I've heard of sooner than that. So it just really depends on the amount of proofs that they have to send in. If they, TennCare is wanting more information from them, maybe they, so TennCare has a new resource tracking tool, so they can go in and they can see bank accounts and things like that that people have. And we have had several people who have had bank accounts that maybe they didn't have anymore or they thought were closed. And they have to send that proof to TennCare that they do not have that resource. So it just really depends on the processing time as far as that goes. But if they get that to them pretty quickly, they could get that. So online, that is the fastest option right now. There is a website. It's on I think it's on the next slide, but it's tenncareconnect.tn.gov. If you go to that website and do the application with them, they will need access to an email address because you do have to create an account for them. We are hopefully working on a portal where SHIP volunteers and staff can do those applications for them in a quicker manner. We had a meeting last week. I've got my fingers crossed that it goes through. We're waiting, so we're waiting kind of semi-patiently. So we will see if we can get access to that. But that online application is the fastest. Usually I've heard people get responses within 3 days because you can actually go in and look at any status on that online application through the app, or through the through the website, so you can actually track it to see what that status is. So TennCare, again, they may ask for more information if you don't send it in when you do the application. My recommendation, especially if you're doing a paper application, the more information, the better. Let them sort through and say they don't need it. Just send, any proofs of income, proofs of resources, bank account statements, anything that you think of that will, help determine your case faster. Just make sure that you send it in with the application. If you don't send it, they will request that information and they give you a very short deadline to meet to get that back to them, or they just stop with the processing of the application altogether. You'll get a letter in the mail that says you were denied. Then you have to go through the application appeals process and just make sure you're getting that in as quickly as possible. Best thing is to send it in with the application at the time. So here are some helpful websites. We've got our TCAD website, and it's actually being updated kind of as we speak. So it's going to be really nice and easy to read. There's going to be a calendar on there that there's a map, and we have east, middle, and west, all of the events on there. So there's a lot of information. So please check out the website. We have kind of redone it lately. Of course, Medicare, Medicaid sites, medicare.gov, tenncareconnect.tn.gov, socialsecurity.gov. Those are all really good websites. You'll get a lot of information there. If you have somebody, if you have trouble with these websites, get in touch with one of us. We'll be happy to hop on with you and kind of go through it and show you where to find everything. There's also a website for the health insurance marketplace, healthcare.gov. I know we don't deal with them very often, but it is available. And for people who may not qualify for like premium free Part A, or maybe they don't have the option to get their Medicare, maybe it's going to be too expensive for them. You may want to send them to healthcare.gov. So this is a good site to know. There is a link for the paper application for TennCare. Like I said, that's not necessarily the best way to apply nowadays, but if it happens to be the only way that you could use to apply, then you could do this application and mail it to them. And just make sure if they do use that paper application to tell them to keep proof of mailing or proof of faxing if they do fax it in. Just make sure to keep that confirmation page because things get lost in the mail, things get lost in the shuffle, and we want to make sure that you can prove that you sent it on the date that you did, and then TennCare will usually backdate it if something happens on their end that they didn't get it. So it's really a good thing to keep if you can. And that is all I have. I think we have plenty of time for questions. I know today's kind of a short presentation, but we just wanted to do a quick rundown of these programs. Like I said, we have a lot of new people and we just wanted to make sure. I'm going to put that back up so you can actually see some of those sites. We will have the slides to you, and this will be recorded and put up on the site as well. So you will be able to rewatch any part of this if you want to. So do we have any questions?
Lori, we have a question from Tom Wren asking to go over how co-signing can affect the beneficiary qualifying for extra help.
Okay, so when you co-sign with a person on a loan or your name is on that property, whether or not you own it or you use it, your name is on it. So it's tied to you. So it definitely can affect. I actually had a gentleman that happened to his income was under QMB limits. He would have qualified for QMB. However, he co-signed for a $100,000 motorhome with his daughter. He never used it, but his name was on it. So he is a co-owner of that property. So